I'm Pat Salber at broadcasting with Health Innovation TV at Health Datapalooza in our nation's capital. And I'm absolutely thrilled to have sitting next to me the rock star of Health Datapalooza, Bryan Sivak. And Bryan, I'm going to leave it to you to explain to our viewers your title and what it is that you do.
Sure. So my title is the Chief Technology Officer and Entrepreneur in Residence at the Department of Health and Human Services. And it's an interesting title. The CTO part is probably pretty self-explanatory, leveraging technology to help transform healthcare, and the delivery of human services. But the Entrepreneur in Residence part might be a little less explanatory.
I just have to stop you there and say, it seems to me that most people would say, government and entrepreneurship, isn't that kind of an oxymoron?
In some cases, yes. But one of the things that we're really trying to do is increase the amount of creativity and the ability of people to do interesting things within this sort of massive bureaucracy we call government. There's an amazing pent-up potential and demand for this stuff. One of the things that I like to talk about, I've started a couple of companies, I've worked with some great people, but some of the best people that I've ever worked with, some of the smartest, most dedicated, most focused, are people that work within the government. And this has just been a revelation to me, and it's something that I think that's where the EIR side of my job comes in, is really encouraging more entrepreneurialism and sort of the freedom and ability to act within government.
Well, so despite the fact that I made that little joke, I have to say that spending 2 days here at Health Datapalooza, it really is just a hotbed of creativity and lots of entrepreneurs here. And I have to say that there's a level of energy. You've created a community that is buzzing. Can you say a little bit about that?
So, this is my first Datapalooza as the CTO at HHS, and I got to tell you, getting out on stage yesterday morning to kind of kick the whole thing off, I was just blown away by the energy. I mean, at 8:30 on a Monday morning, right? The energy in the room of 2,000 people, and how excited everybody here is to get into this stuff, to talk about it, to do it. It was just phenomenal, and that energy and that excitement has not waned over the last couple of days. It's just been phenomenal.
And so could you just say a few words about what you hope to accomplish with Health Datapalooza? What is the point? I know that we now are all called paloozers, which is an interesting word, but really, what are we trying to do here?
Yeah, we should stress that it's paloozers so that it doesn't sound so negative, right? But
yeah, I did think it was, so I get it, I'm a paloozer.
No, this is not what I'm trying to say. No, but it's a great question. And I was actually just talking to somebody else who asked me, how do we measure success? And so, first of all, I think that a key metric and a key way to measure success here is, do people come back next year having, found some inspiration, having met some people, having made some connections that allow them to execute on some new ideas or do new and interesting things. This is something that we always look for, and hopefully we'll be able to take advantage of at next year's conference. Obviously attendance is a great metric, right? And over the past 4 years, it's literally grown exponentially. So
how many people are here this year?
Well, we had, so we were shooting for 1,800 registrations. As of yesterday afternoon, we had 2,004, which has gone up today. So we're doing great. I mean, this is obviously something that people are really interested in.
Well, judging from the jam-packed hallways and running out of lunch yesterday, I'm sort of thinking next year you're going to have to move to the convention center.
Well, actually, it's funny. We were in the convention center last year, but in a sort of small piece of it. I think we haven't actually finalized where it's going to be next year, but it's going to be probably one of the big hotels downtown that just has massive space available for this kind of stuff. I mean, if we're at 2,000 this year, maybe we can do 2,500 next year. We'll see. But this stuff. What happens is that people come, they get excited, they see what's happening, they hear some great talks, they go see some great apps expos, things like that, and they tell people, right? And then those people say, hey, that's somewhere I should be, and so next year they come. And I think, obviously that adds to that exponential growth, right? Because if one person tells 5 people, then, obviously you're going to expand. So it's been, I think that's really, it's been pretty awesome.
So there's been so many exciting things here. If you're comfortable doing this, I'd love to hear what you think 2 or 3 of the highlights were over the last day and a half.
So I thought Jonathan Bush's keynote was fantastic and hilarious, he definitely knows how to light up a room. He did a great job. I think the one thing I'm really looking forward to is our first ever Codapalooza, the live codathon that was been happening here over the last 44 hours.
And the topic of the codathon?
So what we did is we actually did something we've never done before, which is we gave people Medicare claims data, a limited data set, and made them sign data use agreements, and then gave them a challenge problem and said, you have 44 hours to solve this challenge. And what's interesting is that the challenge was actually highly relevant to a big problem that we face in healthcare today, which is as payment models move from fee-for-service to bundled payments or payments for value, how do we measure some of this stuff? How do we help physicians track population health or track the health of an individual patient? And so that was part of this challenge. And so these guys and gals actually, have literally been locked in a room for 44 hours coding away. And so we're about to find out at 5 o'clock today who's the winner is, and I couldn't be more excited.
Well, that does sound exciting because I know that next week there's a couple conferences here in town around accountable care organizations, and I would suspect that they might have a little interest in the results of this codathon.
They actually, that is the main point of the topic of the codathon is how do you help an ACO or an accountable care organization be an ACO? And so it's going to be excellent. I cannot wait to see what these guys have come up with.
And that's 5 o'clock today.
5 o'clock today.
Okay, well, we'll have to grab you again and find out who the winner is.
All right.
Anything else?
The Apps Expo has been phenomenal. If you haven't walked around down there, I highly recommend you do. One really great thing is that we've had a whole delegation from the United Kingdom come in this week, and we have 10 companies that actually paid their own way from the UK to come and present here and at the Apps Expo. The thing I think that's incredibly cool about that is it goes to show that even though we here in the US exist in a very different system than the UK exists in, a lot of the problems that we have are exactly the same problems. And so, the data that we're releasing is relevant to the data that they're releasing. The algorithms that they're creating are relevant to our algorithms. We can probably swap them out, for whole. And some of the companies and technologies that are being created are actually I think incredibly useful and valuable on both sides of the Atlantic and probably around the world. So
the beginnings of a global big data community.
I think so.
Well, I'd like to close by talking about this last 5 years in healthcare has been incredible. I mean, we kind of went along like this, not making much change, and then the last 5 years it's been, you used the word exponential, it's been exponential. Where do you think we're going to be 5 years from now?
You asked me to put on the sorcerer's hat and look into the crystal ball.
That's exactly it.
5 years from now, all right, let's make a prediction. I think that we will be well on our way to having a new payment system in place for much of the country. I think we'll actually have we'll have a very significant number of relatively new folks in this country covered under healthcare coverage for the first time, thanks to the Affordable Care Act and the health insurance marketplaces that are spooling up this year. And as a result, we will have faced and hopefully solved or started to solve some of the big challenges that'll create. So a great example, we already have a shortage of primary care doctors in this country, especially in certain areas. And once we start giving people access to care, that problem will probably get a little bit worse, right? But what I think is going to happen is that, one of the things that America's great at is figuring out solutions to problems like that. And so we'll start to see things like, new ways of doing telemedicine that actually allow remote care to happen and excess capacity in the medical system to actually be used where it's needed as opposed to geographically, physically where it is. Other things that I can't even predict, right? But so I think, to go back to answer your question, many more people will have access to care. The care that we're providing will be at a lower cost and a higher quality, and data will be the thing that has transformed almost all of that.
So do you think at the end of 5 years we can say that we actually met the triple aim?
Wouldn't that be wonderful? I think I think 5 years is a pretty short time frame to imagine that we can turn such a massive ship around in such a short period of time. It's going to take longer than 5 years, but I would hope that within 5 years we are much, much closer to meeting that goal than we are today.
Great. Thank you very much. It's been really wonderful having a chance to talk to you, and it's been incredible being a part of the Health Datapalooza community. Thank you.
Thank you very much.